Hi there, welcome to the first session of Safety and Quality Improvement TV. I'm Monica Shaw, founder of Safe Visual Solutions, and this is the place to be if you want to make an effective and frustration-free clinical environment. We're very excited. This is the very first session, and in these sessions we're going to be talking about the frequently asked questions that you ask me. So, where do these come from? Well, of course, through our website, or through your emails, or through our Facebook site, or even Twitter. And a lot of the questions are quite common now, so we're going to explore them in a bit more detail through these sessions. But first, what I wanted to do is just tell you about me. So I've been nursing for over 15 years, and I've been doing quality improvement for the past 6 years. And in that time, I've become an improvement advisor. And what I've learned is that it's possible to create a frustration-free, high-quality environment that is really great for patients and for staff. It not only has an impact on the flow of the hospital, keeping staff and patients satisfied, but it also has a big impact for the safety of patients. So if you're dealing with problems that just won't go away in the safety arena, stay tuned, because this is where we explore and talk more about those issues. So send any issue you like in, we will address them here. So today what I wanted to do is talk about a frequently asked question that has come in from Rebecca. Now Rebecca's from Bentley in Victoria in Australia, but I have to say we get inquiries from all over the world. But let's start with home first. Now, Rebecca actually writes to me, my problem is getting staff to change or do what they're supposed to do. I have a busy ward in a very busy hospital. I feel like I have tried everything, but nothing seems to work. My staff are frustrated and so am I. I'm really at a loss, so what else can I do? Thanks, Rebecca, and as I said, that's not an uncommon question, and it's a great question. I'm just wondering though, by staff, do you mean your staff or do you mean medical staff? Communication between staff members is absolute key to safety. In fact, whenever a safety incident is broken down, what we consistently see is that communication is a big issue. Apart from the things like protocols being followed properly, from standards being maintained, by things getting missed as well, communication is absolutely key. Now, the interesting thing, which I don't think you might have tried, is actually understanding and establishing what people believe each other should be doing, or expectations. This is a great place to start. What I mean by this and how you actually do it is, if it's medical staff you're talking about, that you might be finding that hard for them to do things that you want them to do or that they absolutely need to do, I would actually start by asking them a few questions and do it via a survey, a really quick survey. But it's just a 5-minute set of questions that really starts to tease out, what are they actually expecting from you or your nursing staff? Are they expecting that there's going to be a nurse on the round? Are they going to be expecting that someone will read the notes when they write up the notes? Are they expecting that, key changes in patient care will be picked up no matter, irrespective of when the ward rounds are actually being done? So it's very important to ask them a couple of key questions around that. Then you need to ask your own nursing staff and even ask allied health staff like physios and occupational therapists that work on your ward or your clinical environment. So you need to ask them similar questions. When do they expect to be communicated? What do they expect to be communicated by the medical staff? Do they expect that they should be on medical rounds? What is it that they understand should happen? Then you need to look at both pieces of information from all three groups and really start to establish whether there are some gaps in what people think they should be doing versus what is actually happening. So, Rebecca, We've done this a number of times, and let me just say that consistently there is a mismatch between what people think the other staff group should be doing and what they know they should be doing. So I'm sure you haven't started with that one, and believe me, it wasn't the first thing that I had thought of when I was doing improvement in the early stages. And when I was a nurse unit manager, I wish I had have done that because it would have made all the difference. So you might have orientation manuals in place. You might be giving the rotational spiel to your new staff, particularly medical staff, about how things actually run. And you might be having the conversations with your nursing staff around what they should be doing. But then you need to actually step back and have a look at what's going on. And that's sometimes really difficult to do. So if you can't do it yourself and be objective enough to observe what's happening, I would ask someone from a different clinical unit just to step onto your unit at a busy time and to give you some feedback about what they've seen happen. So the sorts of things that they might see is that a medical round came and went, was done, nothing was written, the medical team walked away, and nothing was communicated. Other times they might actually see that a medical team might come in, tried to find a nurse, couldn't find a nurse, got frustrated, left, and then weren't responding to pages later when people were trying to chase them. So these sorts of things are really key, and they tell the other half of the story to that survey that you've performed. And this is really important for completing a full picture. The next thing you need to do once you've got all of this information is to, first of all, take a deep breath. You can do something about this information. And usually what you'll be finding is that there's not only a mismatch, but there's also inconsistency in the way people are working and operating. So, for example, I know that on a ward that I used to work on, some of the nurses in charge would actually make a point of attending all of the patient rounds with the medical staff, and others were of the mindset that there were other things more important to do. So, you know, you really need to make sure that people are A, understanding what's expected, B, understanding what's expected of each other, and C, are actually doing what's agreed to. So that leads me into my last action for you. Once you've got all this information, the key thing to be improving is really to make agreement between the staff groups. So feedback the information that you find in a non-blaming way. It's very important. And ask them for help. Ask them, how are we going to make a difference here? What's going to work for both? What's a new way of working that we can do together? And once we've found that way of working, i.e. whether it's a nurse is always on the rounds, or that the medical group don't leave the ward until they've actually handed over the information to a nurse. So once your ground rules are actually set in place, make sure that everyone understands what the new procedure is, and then you need to monitor how that procedure is happening. I can guarantee you that by taking the step, doing a quick survey, asking the obvious questions, and setting a new standard is what will deliver you the outcome that you're looking for. I'm Monica Shaw, and thank you, Rebecca, for your wonderful question. This has been the first recording for Safe Visual Solutions TV, and I look forward to hearing more of your questions. You can email us at info@safevisualsolutions.com, or find us on Facebook.com/Safe Visual Solutions. So thanks again, and I look forward to seeing you in another week's time.